My name is Blair Palmer. I work with the UNICEF Innovation Unit, and on behalf of our team and UNICEF Worldwide, thank you all for coming to Wearable Technology for Social Impact with you. We have a great panel. If any of you all noticed, there's a lot of lovely women on the panel, and Ian. So we're very excited to have everyone here. Who I am.
The bookends.
Yeah, Daniel. Who I am, I'm an epidemiologist by trade, but I work here in San Francisco with, we're a startup as well, the large team of two, and myself and Erica Kochi, who co-leads the unit with Chris Fabian, who's madly tweeting in the front row. Chris, say hi. Who's visiting here from New York with us tonight. So we're really happy to have you here, Chris. Thank you. Who is UNICEF? So I'm going to just give a brief tee up for that, and then I'm going to put it over to the people that are way more interesting. We are in 135 countries. We work directly with government to deliver essential services for children, which is health, education, water and sanitation, HIV/AIDS, and child protection. We have 12,000 staff worldwide, but 88% of our staff are in actual country offices or in the field. Some interesting facts about UNICEF that you probably don't know. We buy 1/3 of the world's vaccines. We responded to over 300 emergencies last year. And we also are the largest purchaser of pencils in the world. I like that. So who is UNICEF Innovation? Because we are tiny. Amongst 12,000 people, I always say we're scrappy and nimble. We're 70 people worldwide. We are at 15 labs across the world, including the one that we recently founded in San Francisco. And we partner with private sector companies, entrepreneurs, academia, governments, hopefully maybe some of you, to make all of this happen. In San Francisco, as part of our launch officially here, as well as our lab, which is based at Singularity University, where Daniel is from at NASA Ames, we are doing a series of conversations around technology growth areas that can have tremendous social impact, and one of them is in the wearables industry. So we invite you to ask questions, be part of this conversation today, live tweet. We have a nice Twitter call going on. There's the hashtags. And we're so happy to be at Wearable World. Reg, thank you. I do love you dearly, even though I drive you nuts. And our partner, Frog Design, has been instrumental in helping us put together these series of conversations that we'll be having throughout this year. One of them, obviously, starting with wearables. We'll be doing one on identity, a workshop on transportation logistics, and then the final one on mobile financial inclusion. So come to all of those too with me. So now it's my privilege to introduce our esteemed moderator, who I also adore, Dr. Daniel Kraft. And his bio is insane, so I'm definitely reading it. So I apologize in advance. So who's Daniel? He is a Stanford and Harvard-trained physician scientist, inventor, entrepreneur, and innovator. With over 20 years of experience in clinical practice, biomedical research, and healthcare innovation, Daniel has chaired the medicine track for Singularity University since SU's inception, and they are a key partner for us. We're very appreciative of all of their support, in addition to an extensive career in academic research. Daniel holds multiple patents on medical devices, immunology, and stem cell-related patents through faculty positions with Stanford University School of Medicine and as clinical faculty for the Pediatric Bone Marrow Transplantation Service at UCSF. Say that 5 times. Dr. Kraft recently founded Bionic Health, focused on enabling connected, data-driven, and integrated personalized medicine. He is also the inventor of the Marrow Miner, an FDA-approved device for the minimally invasive harvest of bone marrow, and founded Regen Med Systems, a company developing technologies to enable adult stem cell-based regenerative therapy. To share some fun facts about Daniel, because we always like to do that. He's an avid pilot and served in the Massachusetts and California National Air Guard as an officer and flight surgeon with F-16 fighter squadrons. His research on aerospace medicine was published with NASA, where he was a finalist for astronaut selection. So jealous. And he's also the proud father of a new baby boy. So, Daniel, thank you so much for being here again, and please give a warm welcome to Daniel Kraft and our panel.
So just a bit of framing here. So I mentioned the partnership with UNICEF and Singularity University. How many folks know who Singularity University is here? So a fair amount who don't. Just really briefly, because I think it sets the stage here. It's a 5-year-old startup based at NASA Ames in Mountain View, and the mission is to bring current and future leaders together to understand fast-moving technologies, how they're coming together, converging to address grand challenges in the world, whether it's poverty, education, healthcare, environment, and beyond. So we have a 10-week program in the summer that'll start in June, and 1-week programs. There's tracks in medicine, which I chair, biotech, robotics, artificial intelligence, nanotechnology, and beyond. And the theme that I think integrates with wearables is many technologies are moving on a sort of exponential pace, meaning they keep doubling, Moore's law, which is why our smartphones in our pockets are about 1 billion times more powerful and less expensive than the best supercomputers in the 1970s. Our iPads are the equivalent of a Cray supercomputer. And the wearable element in the world is being enabled by all these, what used to be, thousands or tens of thousands of dollars of large, bulky equipment shrinking into low-cost elements that can be worn. And again, the meme of Singularity U and the program I run once a year called Exponential Medicine is to look at where technologies are heading. So I think part of this panel will explore what's here today, and where the puck is going, and how those can come together to address needs across healthcare in the developing world and for social impact and beyond. So we have an amazing panel of really diverse, talented set of accomplished folks who are doing work that touches wearables and technology in a variety of spectrums. And I thought we'd start off with each panelist sort of doing a quick intro, who they are, what they're doing, why they're here, and then we'll dive into some questions, and then we'll take audience participation as well. So I guess we're going to go in order. We'll start with Noor.
Hey, so my name's Noor, and about a year ago, I went to some of the most cutting-edge hospitals in the country and was really, really disappointed with the type of technology that I saw there. Can you guys hear me? So yeah, I was really disappointed with the kind of technology that we saw in hospitals. So you guys all have Uber, you guys all have Instagram. With Uber, you can instantly call a cab and you can see where it's arriving, and it's just great, perfect technology. With Instagram, you can take a picture and then instantly share it with thousands of your friends. This simple technology isn't really established in healthcare, so there's a huge disconnect between ambulances and dispatch and the emergency room department. Why doesn't the emergency room see when the ambulance is arriving? Why would this know the severity of the case? So I saw this really strong need in healthcare for better technology to connect to clinicians. So what I ended up starting with this company called Remedy, and what we built is a clinical collaboration tool on Google Glass that allows any provider with a patient to show what they're seeing to a remote provider. So in terms of social impact, we're all here because we want to make social impact. What we're really trying to do is trying to improve the delivery of healthcare remotely. So right now, all the academic centers are in Boston, are in Cambridge, are in New York, or in San Francisco. How do people who are in North Dakota and Oklahoma get access to care? So what we're trying to do is develop a better model for a more efficient delivery of healthcare expertise.
Thanks, Eric.
Hi, my name is Erica Kochi. I co-lead the innovation unit at UNICEF, and we're a group of designers, developers, crazy thinkers that try to integrate technology, design practice, innovation into our work around the world. So this, my journey with technology started about 8 or 9 years ago when I started seeing cell phones in even the most remote locations around the world, where there was no electricity at all. And sort of this got me thinking about, well, what did this mean to have this two-way communication device in people's hands? And for us, it's meant a lot. It's meant that we can have conversations with people even in the most remote locations in the world. But more and more, it's moving into not just that sort of voice call or that text message, but we're looking at what the future of this is and the data that this produces and how this can be meaningful in changing millions of children's lives around the world. So as UNICEF, we're just starting to explore the space of wearables. We have some very low-fi, low-tech wearables that we've been using for many years, which I think Denise is going to talk about later on. But we see this as a really exciting space that has tremendous potential to touch millions of people's lives around the world.
Hi, I'm Denise Gershbein. I'm with Frog Design, and Frog Design, you may or may not know, is a global product strategy and design firm. So we work with companies around the world to uncover opportunities and then design and bring to market products and services that ideally advance the human experience, whether that's social impact or consumer products or services or processes. I think you have an example of that up on screen. So we do everything from the strategy to the software, to the service, to the UI, to the brand strategy, interaction design, mechanical engineering, industrial design, ideally within large product and service ecosystems. So sort of an end-to-end play across physical and digital and sort of everything in between. Why are we here joining this conversation? Why would you put a design firm within this panel on social impact? It's because a designer's role, design's role in this community is to help us all sort of think about what are the translation points between the technology and the actual needs out in the field. And the way that we can do that is by helping our clients and our partners actually think about where do you uncover the value for the end users and for the companies or organizations. And so our story with wearables, this is actually the Disney Magic Band behind me. I don't know if any of you are familiar with this story, so this is just coming out into the Disney parks. This is one example of a wearable, and people don't actually think about this as a wearable perhaps, but it's a wristband with an RFID tag within it and allows you to sort of go through a lot of processes within the park. This is on one end of the spectrum of wearables, and then on the other end you might have things like the Bill Gates newborn backpack that we did with UNICEF. So a wide range of applications. But what we're really thinking about with wearables and why I'm excited to be on this panel is because we want to help move the conversation on what is a wearable. What does it mean? Designers tend to think about things in terms of metaphors or analogies. So if you think about typical wearable devices today, like the Fitbit or other sort of wellness and exercise devices, it's really kind of like a spigot that's spitting data at you from a very tiny pool of data. And it's spitting that at you, and you can sort of make sense of what that is. Then you look at the Disney Magic Band, and that's more like a key, something that you use to unlock a world outside yourself. And I think that's really important as we start to talk tonight about what is a wearable and how do you think about it in terms of social impact.
I'm Pampa DeBroy. I'm the International Programs Manager for Embrace. Yep. Can you hear me? Closer? All right. There we go. I'm Pampa. I'm with a company called Embrace. Embrace is an organization that came out of the design school at Stanford University. And the co-founders, actually one of them is here, Rahul. The co-founders did a lot of research regarding neonatal hypothermia. And what they were finding was that there's a lot of devices out there that do not necessarily fit the needs. So 20 million premature infants are born every year. 4 million die every year. And there's a gap between what currently exists in the field and what's needed. And so what they did is they used design thinking to go and examine what was currently happening, what devices existed, and they found that there was a need for a device that was lower cost, that was portable, that did not necessarily need consistent access to electricity, and that sufficiently regulated temperature and was safe and effective. And so they developed a device called Embrace Nest. It's a portable infant warmer that regulates temperature in neonatal infants. And this is actually the technology itself. So there's a warm pack, a baby wrap, and a heater, which heats the device. And it keeps babies warm for 4 to 6 hours. And so I'm with the nonprofit side of the organization, and we actually create programs around neonatal hypothermia. And so we're finding that sometimes in very low resource settings, this device is very important in being able to regulate temperature in conjunction with education and training programs as well. And so we currently work in 11 countries. We've impacted the lives of 60,000 infants. And we're primarily working actually in India, Uganda, and Afghanistan at this point. So very excited to be here to join the conversation about devices that actually do impact health as well. So thank you.
Hi, my name is Tan, and I'm the founder and CEO of a company here locally called Emotive. We're a pioneer and innovator in the space around bringing electroencephalography, or EEG for short, which for anyone who doesn't know, it's basically electrical fluctuation you can observe from neurons interacting in the brain, so it's essentially brain waves. And bringing that from the clinic and the labs into the real world so that you can study contextual brain measurement observation. This product here is something we kickstarted last year and joined the Kickstarter Millionaires Club. It's the Insight. It's coming out later this year. For the longest time, we've focused on scientific contextual EEG. So that means that it's a research device. Why do we care about this social impact space, and why does this device matter? Well, it may surprise you to hear that there are 2 billion people worldwide suffering from some sort of neurological condition, impairment. It sounds like a staggering number, but by the time you kind of unbundle the conditions, it covers everything from anxiety, depression, to more complex diseases like epilepsy, schizophrenia, dementia, Parkinson's, through to brain injury from stroke or trauma, to learning difficulties like ADD, ADHD, and then in the developing world, cognitive development disorders that may occur as a side effect of treatment from HIV drugs, or even conditions like malaria and measles. And so by the time you factor in all of these neurological impairments, the economic burden is staggering. It's $2 trillion every year. And so this is a very challenging problem. And one of the biggest issues when you're looking at brain observation and measurement is that traditional clinical systems are very expensive and cumbersome. And so our philosophy is to make these measurement and observation systems high resolution but portable and more easy to use, as well as a lot more shareable. And so the data is much more open, and that allows us to allow researchers to collaborate on a global scale. And we're starting to see we've got a footprint in 100 countries, including parts of the world that are we could consider developing countries. And we're really starting to see it make an impact in some of these really difficult areas.
I'm the ugly guy on the end. My name's Ian. I work for ARM. We make processors, so the intelligence that's really in all of the wearables today, all of your phones, but we don't make the chips. And so if you think about your high-end phones, Galaxy or whatever one you want to pick, that similar technology is now being deployed in $20 smartphones. Daniel was talking about some of the advancements that are going on with technology. If you think about the Kindle as a book, we're seeing talking books. We've been partnering with the Literary Bridge to actually provide education on health in northern Ghana on a very low-cost education platform, really providing kind of midwife kind of information in local dialects in northern Ghana. And I think the opportunity here is what is going to go from the sort of Fitbit or some of those other wellness products that Denise talked about. How does that type of technology go down into a type of wearable at a price point and at the right sort of power and form factor that's going to be useful for, let's say the bottom 3 billion people on the planet? It's going to be less about whether they're working out on an elliptical machine. It's going to be about wellness and improving quality of life in some very difficult conditions. And that's our interest in driving that technology down that value chain.
Terrific. All right, thanks. But it was when I was thinking about this panel, I thought, how does this blend with social impact? So I thought the first question we'd send would be to Erica, because we think, when we think UNICEF, we think, disasters, remote locations. So how is UNICEF thinking about wearables in a broad sense, and what might some of the use cases be beyond maybe infectious diseases and non-infectious diseases, which are overtaking some of the challenges in many parts of the world?
Yeah, definitely. We're obviously thinking in the non-communicable disease realm. So the diseases that you have, which you don't get from someone else, but are such a large burden to society. They kill 36 million people every year, and 80% of that burden is in emerging markets. So obviously, chronic disease management is a huge thing that will continue to grow, and we really need to be thinking about how do we best manage that, whether it's in children or adults. So yes, obviously we're thinking in that space, but more than that, the thing that really I feel passionate about, and I think are also very important for UNICEF, is people who are not usually served by the healthcare system. So one of my slides before, the slide that introduced me, it was a picture of a couple of women in the middle of a road in South Sudan. Usually when we think of Sudan, we think, you know, dust and dirt. But for a couple months a year, it's the rainy season, and these people get cut off from supplies. Roads are essentially just flooded. And so when you think about what that means in the terms of health, there is no access to doctor. There is no access to a trained physician. If you have an emergency, if you are delivering a baby and you can't, you need to get to emergency care, you can't do this. And so when I think about wearables, I really think about it in that situation, for those emergency situations. So I look at the Embrace warmer, for example. If you can have something like that, and it's producing, it's also producing data, you can really think about targeting care in emergencies, whether it's in the first week of life, during that really, really fragile period, or when you're thinking about tracking people through care. So one of the biggest challenges that we face as UNICEF is we'll diagnose a child with pneumonia, for example, but then we don't know if they go and get the drug at a different clinic, or if they're taking that drug, or what happens as an outcome. And I really feel like if you can think about a low-cost wearable device that could actually help track children through these really essential points of care, you start to see less fall off. You start to be able to use the data that all of these wearables would produce to allocate more resources to it and really know what's happening now, not just what happened in the past. And you can also have the ability to do something about it right now.
So what we're really talking about here is sort of the ability to have a feedback loop. And it might be diabetes, hypertension, weight, whatever, requires data to come back, and that data needs to be presented and understandable by the clinician, by the patient, by the system, and then take next steps. So I think, you know, it's not just wearable, it's the fact that you get information that becomes useful. So for Pampa, so the Embrace Warmer is actually a true wearable. Your little preemie, and I spent lots of times in neonatal intensive care units, would literally wear this device. So it's not necessarily purely high tech, but you're going to be, as we talked about earlier, maybe adding sensors to have some of the temperature feedback loops in. But I'm wondering, what are some of the lessons you've learned and your company's learned in developing that sort of technology in the less advantaged world that could be applied to the emotive headset or to Remedy or others?
Right. So, yeah, in some ways, Embrace is really not a high-tech device. It's a pretty simple technology. And really what Embrace, I think, learned was that it really is about user needs. And so they use the user-centric design approach, really, to understand what the needs were. And as we're developing programs as well, with respect to neonatal hypothermia more broadly, we're finding that it is very important to understand cultural context and adapt accordingly. And so it's about understanding what the user wants, the user will use. We're finding that getting someone to adopt this is not just about the government officials to accept the device or the doctors. It's also about the mothers wanting to use the device, the nurses liking the device. So it's really across every level and every layer of the stakeholders involved. And so it was interesting as well. I think one story that kind of exemplifies this is a few months ago we were starting a program in northern UP, and this is a place where they have light bulbs actually to warm babies before Embrace started programs there, and the light bulbs sometimes shattered, were not necessarily effective at warming them. The incubators that the district hospital had were kind of discarded and put towards the side of the hospital because they were broken or they would overheat. And so in that context, we talked to a nurse and we kind of went around and did a baseline assessment, understood what the needs were in the hospital or the facility. The nurse took out a thermometer because we asked her to. It was in a locked closet. She took the temperature of an infant and found that the thermometer was actually broken and not working. And so that was something kind of shocking to us, that this was something that was not readily done, right? Nurses don't even take temperature in these settings, much less even have working thermometers. And so that was kind of an aha moment for us that we needed to restart thinking about what was needed in this context. That we needed to provide thermometers, we needed to provide training in this context to the nurses and to the mothers as well, so that when they leave the facility, they can provide kangaroo mother care. And so I think spending a lot of time in the field, understanding the users on multiple levels is really important and something that Embrace really thought through when designing the device as well.
That's a perfect example. I was as a BMT fellow, bone marrow transplant fellow at Stanford. I went through the first year of the biodesign program. The whole first quarter is about need finding and not just having a technology applied to something, going into the field. So what many of you are working on technologies or have ideas for products, the lesson here is go and sit with the doc or the patient or fly to Uganda and see what's happening there, because you're going to be surprised about the actual challenges of what the need is and the different pieces of that, whether the thermometer is locked away or there's some cultural barrier to wrapping up a child maybe in some facility. What do you see happening in this space? These are starting out as, they're hard to get here today, but with ubiquitous technology becoming lower cost, the bottom billion having SMS phones, soon having smartphones. Where do you see your platform heading, and what are the opportunities and challenges on the more social impact realm?
Yeah, so right now we're focused on Google Glass because it's the most well-developed wearable. There are other wearables, for example, like the Recon Jet, which is a more ruggedized version of Google Glass, essentially, which we're thinking about deploying in disaster response and trauma type of situations. Because Google Glass, for example, you can be in a situation where it's raining or where there's if a firefighter, there's high heat. Obviously, it makes more sense to use something that's is a bit more rugged. But the real advantage of Google Glass over a mobile phone that is more easily available is that it's hands-free. So a doctor, when they're intubating a patient, they can't be doing that while they're struggling with a mobile phone or something like that. So our platform, the key advantage is really that the doctor is able to take pictures, take videos, get real-time remote guidance while they're hands-free. So that kind of makes it less meaningful to be on a mobile phone or a tablet, even though it is more accessible. So in the short term, I think that the social impact that we can really make on glass and on wearables that are coming out soon is in disaster response and in increasing access to care. So in disaster response, what's really exciting is being able to have multiple people on the ground having mission command, able to see multiple vantage points. So you can imagine someone on supply, someone on trauma, someone on the various teams that are able to coordinate what's going on. If they're all able to see what's going on from their vantage point, mission command has a much better idea of being able to say, okay, it makes sense to deploy this resource here, or to, for example, if someone is undergoing something like a broken leg, having a doctor be able to remotely guide the person on scene with how to respond to the situation makes a lot more sense than having to wait till they get to the hospital for the next access point. So the real vision behind Remedy is that whenever you come in contact with anyone in healthcare, you have contact with the entire healthcare system. So instead of having to repeat your story at every single checkpoint, everyone who is involved in your care can be brought to you, and that's what we're really trying to do with the wearables.
A use case maybe you might be able to deploy folks through disaster who have, let's say, EMT-based skills. They could be wearing glass or something similar and be mentored telepresently by a trauma surgeon in New York or San Francisco. Right? So you're able to add skills and situational awareness to anybody sort of on the planet, as long as the connectivity is there. So in a UNICEF sort of type scenario where you might have community health workers, elements of malnutrition, diagnostics, how do you imagine your tools being there for the sort of the caregiver beyond the individual who lives in the location?
Yeah, so I think the benefit of a system like ours is, first of all, the cost factor. So a traditional clinical EEG system would cost in the tens of thousands of dollars. So being able to have an equivalent system for a few $100s, that order of magnitude matters in certain parts of the world. The second thing that I think is really valuable is the fact that you don't have to be a trained technician in order to put it on, because it's been designed for a general consumer audience so that any novice, non-medical trained user can put it on their head and figure out how to get a clean signal. You can train medical workers to be able to don the device on children, patients, and collect data. And then I think the third most powerful aspect of it is the fact that you can then send the data via the internet to collaborators, whether it be here in the United States or in Europe, different parts of the world, and people can share in that data and share in the diagnosis, in the course of action to take for that patient, and that data can start to be aggregated so that you can start to find features, so you can take the benefit of machine learning and better classifiers, which we're really seeing a huge improvement in the last 5 years. And so I think that's really where I see the greatest opportunity. It's very early days for us in terms of deployment in those regions of the world, but we're already seeing that it's a model that works. I haven't been out there personally to understand and to observe for myself how it's been used, but certainly in parts of Kenya where they're already familiar with using an EEG system. Using our epoch is very, very easy, and it's so affordable they can have several of them instead of just having one. So that's been a nice introduction to how we might be able to deploy this in the developing world.
Really, headsets like yours are becoming platforms, just like folks are building technologies on glass or Android or Apple. There's a lot of surprising elements. There's been companies that have done apps for meditation, so which combine, or for treating attention deficit disorder, and all those have first world and third world implications. What are some of the sensibilities that you're seeing in terms of a lot of wearables aren't necessarily fashionable today, and we're not even sure how we interplay the ones I'm wearing on my wrist with long-term health. How does a designer play a role in this whole process as you start to integrate these?
Yeah, I think it's, I think I mentioned this in my intro, but it's really important for us all to think about how we categorize these things and think about them, right? So I touched on the idea of a wearable being something that either unlocks the world for you or brings information to you about yourself. I think we can also think about wearables in terms of your use cases, Erica. Is it something that is a device used for control outward, or is it, again, a monitoring or sensing device of myself? So your use case around maybe there's the doctor in an urban setting but can't get out to the rural locations because of weather or bad roads or whatnot. So that doctor needs the ability to wear the Remedy headgear and control things from far away. Whereas the Embrace, the warmer, is really about monitoring or sensing of an individual over time. And so I think we need to think about those kinds of classifications of wearables and not just think about them in terms of what's fashionable or what am I willing to put on my wrist for the next 3 months. And I think another big issue, Erica gave me an in on talking about this, I think we also need to think about high-tech, low-tech solutions that work in combination. There's a lot of amazing developments happening in the technology world, but it's important not only to think about the users and their contexts, but the ecosystems that you're plugging into, right? So there are always going to be issues of, is there electricity? Is there access to a network? Is there a distribution system? So when I first saw the warmer, I loved it because I was talking to Jane Chen, one of the original founders, and she was showing me this, and I looked at this clear plastic window on the front, and I was like, what's that for? And she said, oh, it turns out that the nurses and doctors actually still wanted to be able to see the color of skin on the infant because that was the easiest way for them to quickly tell if it was in range or not. And here I have a UNICEF object, which is the MUOC, the mid-upper arm circumference measurer. So this is used for determining nutrition. Yes, please. Determining nutrition of children. So this is wrapped around the upper arm, and depending on where the measurement ends up in the green, the red, or the yellow, you can tell very quickly at a glance if the child is malnourished or not. So this is also a wearable of a sort. So I would love to see the combination of these high-tech approaches with the low-tech versions and how they slot into these ecosystems.
I mean, I think in this conversation, I think thinking downstream, we're going beyond wearables. It's not always going to be things that you have on your body. It could be even insidables. This is the Philips eye pill, so think about convergent technology that you can swallow to do an upper exam of your upper endoscopy, essentially. That could be applied in the developing world. Where do you see your technologies and others heading in the next 2 to 5 years that will enable wearables and beyond to impact?
Well, I'm going to avoid the arm inside joke if you sort of take the ingestible. I think if you look at the first wave of wearables, they've used fairly generic parts. So if you look inside the Fitbit, for example, it's a few bits of technology that aren't all integrated into one thing. They've basically put communications, some sensors, and a processor, 3 different chips. And so what you tend to see with these markets is people throw general purpose technology at it first, and that's general purpose software, right? It's general purpose chips. And so if you think about the wearables today, I think there's a lot we need to do in terms of improving battery life. There's a lot we need to do in terms of improving cost. And that comes through integration and really designing for this specific application. It's almost like, you know, down at our nerdy chip level, what you were saying, right? At your area, when you're saying about services and how you have to go and get real use cases from Uganda or whatever, we have to look at what that means at the chip level. And so people designing specifically for this area, because to Denise's point, it's a very different chip from a smartphone, right? It's a very different chip from a general purpose microcontroller that sits in a smart meter. And so I think the first bit is integration and optimization for the app. And I think the other thing that will help with Denise is looking at how you move the intelligence to other places, right? So you'll improve the power by having a very simple system on your wrist, and all the intelligence is on the phone or up in the tablet. And you basically move that task further up into the cloud where there is resources to go work on that, and that should be able to get you to a battery life of a month or 6 weeks, and that's really the push. We're actually involved. It turns out that one of the main burners of power is the actual communications, whether it's Bluetooth or Wi-Fi and things like that. So we've been looking at how we improve the efficiency of radios. We found some companies doing very low voltage radios, but basically the whole ecosystem has to come together to look at all of these bits. You see Google doing Android Wear, which is a more optimized piece of software for the wearables. So I think kind of a long-winded way of design for purpose, more integration, and looking at moving as much of the resources away from the wearable to improve the battery life and the cost of the thing that's on your wrist or near the person itself.
And there are more sort of off-the-shelf technologies now. I think Intel has an Edison chip and others, which folks who want to innovate in the wearable other space can start utilizing and taking things to market earlier, or at least prototyping.
Yeah, and I think it's a great start. It's a great developer base. But if you look at Edison or even some of the ARM-based chips, we're going to have to design more optimally for the particular application, and that will drive down the cost, and it will improve the battery life.
So one thing I see wearing my clinician hat is there are a lot of great technologies out there even today. It might be a connected blood pressure cuff, glucometer, scale, simple feedback loops and wearable devices today, but they're not yet integrated into our healthcare system here, often because the incentives are misaligned. Your physician does not want to see your blood pressure data or your heart rate data from your EKG on your phone case because they're not paid for it. We have the challenges of the regulatory bodies like our friends at the FDA who don't know how to keep pace with technologies, and our payers, the insurers, who don't know how to pay for these things often. So there's an opportunity, I think, in the developing world, and many technologies are leapfrogging. There's a company out of MIT called iNetra making a phone-based case for doing eye diagnostics, and they're taking that to India first, as opposed to trying that in the markets in the West. So I'd be curious, maybe running down the panel, what challenges you see from your company perspective, both in the developing world and in social impact, that you need to keep in mind, and how we might address those.
Sure. Yeah. I think one of the huge considerations is how you're actually going to get into the hospital. So it's taken us, over 4 months to get it into Harvard University and the University of Pennsylvania, even with very strong clinician champions who see the value in what we're doing and have very specific use cases at their institutions that they themselves are going to be supervising and a part of. So I would definitely say that that's a very real challenge. Is how are you actually going to get your technology in the door? Yes, it's going to solve problems, but how are you actually going to get it through IT? How are you going to get it through compliance? How are you going to get approval for it? And then even once you have it in the door, we are facing that very same challenge of, okay, now who exactly is going to pay for it? The value is being seen by the patient. They're getting treated sooner. They're getting higher quality of care, but the patient buys insurance. So is the insurer going to pay for it, or is the person who's delivering care going to be a physician? Is it going to be the institution? Who exactly is going to pull the trigger on paying us, right? So that's an evolving question, and we're thinking, use case by use case is going to be a different customer. So, but trying to find the answer to that question is very difficult. In terms of impact, how are you going to get impact soonest? Like I said, I think that disaster response is a very real place where situational awareness is lacking and where we can add value. But the more immediate way that we're going to prove that value is in these academic institutions like Harvard and UPenn, where we can prove that, okay, yes, the technology works. It works in situations like wound care, where a patient comes in and they have an infected wound, but they don't know whether it needs an incision, it needs to be drained, or they don't know whether it needs surgery, they don't know whether it needs medication. So allowing the person on the ground to consult with an expert and say, okay, the right course of action is medication rather than an incision is a way that we can prove that in a situation like disaster response, this is the optimal way for an expert to provide guidance and provide their expertise.
Yeah, I really struggle with this issue, not just in the wearable sense, but I've been involved in the mobile health world for many years, and I feel like you have the traditional sort of public health industry sort of over here, you have the technology industry over here, and it's as if like they've never talked to each other and they don't understand each other's language. And sort of part of my role has been to sort of try to bring those two together, try to bring the ministries of health together with the technologists, together with private sector companies, banks, et cetera, to start really thinking about mobile health. And for me, when I think wearables, it's kind of an extension of that. And I feel like we're going to have to go through the same pain all over again. Unless you start to think of wearables as a replacement for devices, communication devices that people already have and people already keep charged and spend a lot of money to maintain and to keep in working condition by themselves. And if you think about it as a personal device that I use not just to produce data about my health or about my wellness, but that I use to communicate with my friends, with my family, as a way to share information, to get information, to run my business, then I think you start to see those really fast leap forwards that don't necessarily require, the FDA approval, the Minister of Health buy-in. And I think that then you see something that moves ahead and the healthcare industry has to keep up. And I feel like that's not going to happen here in the US first. I feel like that'll happen in an emerging economy first. I'm not sure how, but I think that's such an exciting space that we're looking forward to discover.
It's also the spaces that we enter. I think Frog Design was involved with the Project M for doing HIV diagnostics in Africa, and the lessons that they learned there were pretty incredible. You could have one village next door to the other, and you need completely different design and messaging and language and cultural sensitivities. So what are some of the design challenges that you might see?
So we touched on them a little bit earlier, cultural challenges around language, the written word, visuals, just cultural expectations in different locations. You certainly have to design for those. And then I think that bubbles up to this question of how do you get these technologies or these innovations out into these areas? And I'm going to admit that I don't actually have the answer to your question, but I would tell you that the way that Frog or similar group would approach that is sort of thinking about how you subvert existing infrastructures that exist. So you mentioned mobile health, which we worked on quite a bit together, and that was about looking at the rapid proliferation of feature phones in many areas that weren't previously reachable by the internet. That allowed us to build a lot of things on top of that, whether it was mobile health or some of the work that we've done at the Nike Foundation, the Girl Effect, and targeting girl groups. Right now we're working on a program where we're looking at how to deliver oxygen to various hospitals, and we're looking at distribution systems there. And I know there's work going on where you're looking at, and Eric, I don't want to steal your thunder, but some things are considered like, how does FedEx get to rural areas, or how does Coca-Cola deliver to rural areas? So I think it's more of an approach than an answer that we have at this point, but I think, again, it's always looking at flipping the system that's out there and figuring out different ways to approach people that are out there.
And leveraging the existing infrastructure. So Dean Kamen, the famous inventor of the Segway and other things, has developed this water purification system, and he's getting it through Coca-Cola as a distribution network. So you can take existing modalities and ride on top of those. Any thoughts from you?
Yeah, I mean, I think distribution is definitely a challenge. Making sure we can get the product to those that need it the most. I also think what I mentioned earlier, so awareness raising. So the fact that many of our practitioners don't understand hypothermia as a problem, that's definitely something that we're coming across in terms of raising awareness for the need for the product. One other thing that has come up recently as we're starting to see our programs fall in the 1 year, 2 year bucket is sustainability of a program. So when we leave a site, how does the site staff really continue to use the program, considering the turnover of staff members, for instance? And how can they continue to make sure that the product's fixed, and that we can continue to get product components to them? So these have expiration dates, and after a certain amount of time, they do need to be turned over. And so just making sure that a program is sustainable and that it's driven by the community itself as opposed to us as an external organization is definitely a challenge that we're seeing. And hoping to combat by developing strong hubs in different communities.
Well, for us, our challenge is a little bit different. So we started our life as a tech company and really didn't go down the FDA approval route. Well, went out as an FCC ULCE, so essentially an electronics product. And so that's really helped us build our market space and segment. I think we've been able to make some positive impact in various sectors, whether it be in helping people through rehabilitation or through people who are severely immobilized, to have some form of communication, extend some sort of independence for them. But to really reach the far-reaching social impact that you're talking about in parts of the world where we see that this technology could have reach and impact, we really need to go back to the drawing board and really design for that purpose, because as much as this product has some of the hallmarks and some of the features that would be useful and helpful for a developing country scenario, it's really not designed for it. And there are certainly a lot of challenges that I can see, whether it be charging, electricity, how we're sending the data. There's so many challenges that it really needs to be designed for purpose, as opposed to, you know, jimmy rigging a system that's really designed for a developed world scenario with affordability and all these sort of wearables, convenience, and then try and send it out to the developing world. I mean, it's great as a proof of concept, but it's certainly not deployable.
Okay. To add to the misery, I think people's rights in terms of ownership of data is going to be an interesting topic. There's already some of that bubbling around here. I mean, if everybody is fitted in a refugee camp with a band, is that going to be okay? Are the people going to be all right with that? Because there's a greater need. It's trying to solve ensuring that these people are healthy. But I think that is one. And I think the other one is fragmentation of standards. I think as people rush to get stuff out, if you envision that we're going to have a lot of systems that are all interacting, there has to be a common framework of how those things articulate what they are, what data I have access to, what permissions I don't have access to. And at the moment, I think everyone's rushed, and quite rightly, to try and get something out there. I think there's going to be a need to actually try and work out how all these things communicate together in a bigger overall plan.
We don't want the Internet of Things not talking to each other, the Betamax versus VHS.
Yeah. I mean, it's sort of been an internet of silos is the risk, right?
And where I see this heading is eventually, just like our modern cars have 200 or 300 sensors in them, we know more about the health of our cars than ourselves. You don't care about any sensor in your car, like the piston 4 oxygen sensor. You care about where your check engine light goes on. I think the opportunity for a lot of these sensors, wearables, and citables is to provide predictalytics, the idea that this data, you don't want to look at any of these streams, whether you're in rural Africa or the clinician in San Francisco. You want to see the integration of that data so it's useful, and that these sorts of sensors and wearables start melding into our environment, into our fridges, our cars, our baby warmers, and beyond. So I think we have some time to open it up to the audience, and Blair?
Hi, I'm one of the founders of Embrace. Very interesting conversations here from the panel. So I've been living in India for the past 5 years, and I lead product innovation, and we're working on lots of wearable technologies. Question I have for the panel is, in countries where you have a shortage of skilled caregivers, solutions that focus on institutions are unlikely to scale, and they have to be patient-focused. Who is going to own these pieces of technology in those settings? Do you expect the consumer in these low-end settings to actually buy them? Or do you expect governments to spend them? And if so, who's going to take care of it?
I'm not sure. I think we have the same problem in mobile health as well. The way that UNICEF has always approached any mobile health project is that we want to make it scalable from the outset, and we don't see governments or international organizations buying and servicing devices. So we just don't buy devices. We use what people have, and that we work within those constraints. And those constraints do breed tremendous creativity, but they are constraints, right? What it usually means is we're working with feature phones. And so we have to be really smart about how we do the heavy lifting in the cloud, and how we have that fairly light touch point at the end. So that's the way we've dealt with it. I think that if you are a public institution and you're looking at buying and using technology and servicing technology, you need to have a really good argument for why you're doing that versus spending that money somewhere else, especially in really resource-constrained settings. So while it may take off in some private institutions, I don't see it taking off in the public sector straight away. However, that doesn't mean that the device that we hold in our hand, that we all have, which is usually, either feature phone or smartphone, might not become a wearable and might not serve that purpose. And I see it moving in that direction first.
How do you view costs of production as far as accessibility when you have organizations or governments refusing to acquire something simply because they just can't afford it? Is there a certain curve that maybe a year out, 2 years out, say, it becomes more accessible because you're able to make it at a significantly lower cost?
Sure, yeah. So right now, if you're an explorer or if you want to buy glass, it's $1,500, right? But it hasn't been publicly released, and very soon I would expect A, the price point of glass to come down, and B, a lot of copycats to be making other wearables that are much cheaper. So I think there was recently an article that came out that said the parts for glass cost together $80. So I'm sure if that price point is true, then why aren't we going to see Samsung and Verizon and all these other companies and all these startups as well? Why aren't they going to start working on cheaper alternatives? So on us, on the software side, we're kind of following the model that that you just mentioned. That how do you make this really light touch point feed the device? How do you do most of the heavy lifting in the cloud? And as glass come out with XE12, XE17, these new software updates, and our app continues to break, we've been even more. We've created even more of an emphasis on having as little of the processing happen on the device and then as much of the processing happen on our servers as possible. So like I said, we're really looking to improve access to our technology. And as those wearables come out at a lower price point, we're excited to be able to integrate with them. But right now, we are only on glass because it's sort of the best suited wearable for the situations that we're going into. But I'm really excited to see these newer, cheaper, more stronger in many ways, more durable wearables come out as well.
What I would just add, many of these technologies moving so quickly. For those of you who are innovating in this space or aligned spaces, don't build for 2014, build for 2016, where you're going to have, the glass selling for $100, and you'll have the iPhone 9, and you'll have $20 Android tablets being sold in India. They're as good as the Samsung Galaxy today in terms of speed. So there's a tremendous opportunity, and we often fail to imagine how available and cheap and powerful these will be in a couple of years. So there's a real opportunity to innovate across the space if you're looking 2 years out and map that a bit.
Anyone else?
Hi, this question is for Nur and Denise, probably. I'm a user experience designer here in the Valley, and as designers, we talk a lot about empathy, building empathy for need finding with our users, with our clients. And the interesting thing about wearables to me is getting close to the five senses. Visuals, tactiles, feelings now, which was used to me, that's amazing. I'm just kind of curious, in your experience, what has, and what's the multiplier of empathy in the actual product? Like, what's the difference between having Remedy being in Google Glass as opposed to the GoPro, which is on top of your head? Like, can we actually have a multiplier for adoption rates associated with empathy and building empathy?
I love that you bring up this question because, again, if I take it back to what is design and why is design involved in this conversation, it always comes back to what's the form, what's the authenticity of the form that you're using, right? So, Daniel, you started out the conversation asking about, the shape of wearables and fashion and how are we going to get around this issue of fashion and form, but there's an inherent philosophy in every form that we create, right? There's an inherent belief that this form serves this empathetic need with the user, but people have a bullshit radar for that stuff, right? Let's be honest. So I think with any device that we create for people, you always have to understand what you are implying by the use of that device. So the difference between using Google Glass or a headset or some very low-tech object not only implies that you understand the user, but you are sort of steering them culturally or belief-wise or empowering them in some way. So it's very subtle, but I think it's something we really have to pay attention to. It's not just understanding the users and their needs, but remembering the values you are putting into the world with the form of the technology that you put out there, whether it's a band that I have stuck on my wrist that is actually more like a prison cuff because now I'm chained to this data circle and I don't know what my identity is within that, or whether it's something that's more freeing, whether it's Google Glass or GoPro or something like that, where I'm in control, I'm driving. Those are very implicit values there. So that's what we always try to think about when we're thinking about this term empathy and what that means. But what are we putting into the world and how is that driving society and the beliefs behind all of our technology? I'm not sure if I exactly answered your question, but
I think one element of this may not be exactly in terms of is self-empathy. The idea that now with some of these new technologies, in a meta sense, we can start to own our own health and be responsible for our own health. That could be in the developing world as well. It's not your doctor who's going to be responsible. You can have insights into your data, have self-empathy. Even the fact that you might wear a Fitbit or something similar gives you a bit of that consciousness that someone else is watching my steps and has some that Hawthorne effect. I think in a meta sense, we can use these technologies to empower individuals to have self-empathy and own their own information and their healthcare as well.
so on that note, the other thing I want to bring up is the way you just described that is a very sort of bootstrapping approach. And I think that's a very American approach, that if you get the right device and you're given the right data, you can derive the right insights and you can become a better individual. I think we also have to think about just how are you serving people that don't have the same mindset as us, that it shouldn't always be bootstrapping, that there could be a very generous and reciprocal relationship there, especially when you talk about data and identity and what is that going to be like to experience that and be part of that cycle. So I think we also have to caution ourselves to check our American points of view on the bootstrapping, pioneering nature of things.
That's a really powerful question that you asked, and I'm really glad you asked it. So for us, we're putting glass, or we're having Remedy be used by caregivers who are residents right out of medical school, as well as nurses who are going on home visits who are 60 plus years old. So yeah, it was really difficult for us to figure out how do we make this product so simple and so easy to use that someone who's 60 years old can use it, as well as a resident who's really excited and young about technology. What are the design considerations around that? And there's a lot of important information that expert receiving is going to need, right? They need to know their medical record number. So how do you quickly map that medical record number, create a case, and make it something that's an enjoyable experience for this expert who's taking out more of their time to serve this patient, to serve this caregiver. So in terms of empathy, I think that there's empathy in a lot of different places. So on the one hand, you want to figure out how can you make the patient experience better. Patients right now are dealing with doctors who are pulled in a million different directions. Where are they going to get this data? Get entered into the HR? How do they talk to someone else who they need to collaborate with? So empathy on the patient side, how can you improve the experience for them so that they spend more time one-on-one with their doctor and less time with their doctor having to fiddle with technology. So there's empathy there. And then the other huge point of empathy is of the provider who's on scene trying to deliver better care. So providers like nurses, mid-levels aren't really given the respect they're due. When you try and figure out where to get the best health care, you think, okay, where are the best doctors? And you look up the hospitals that have the best doctors. But the reality of the situation is that the quality of your health care has to do a lot more with your nursing staff, the quality of your nursing staff, the turnover rate there, than the quality of the best doctors. So with this huge issue that we have of the scarcity of medical expertise, we have to solve it in two ways. Not only do we have to deliver the medical expertise that we have more efficiently, have these experts deliver more care, but we also have to empower these mid-level providers, these nurses, these physician's assistants, these rehabilitation experts, to be able to do more. And the way that they're going to be able to do more is if they're able to collaborate with those experts more effectively, right? So in a 60-minute encounter, there's about 3 minutes that mid-level can't help you, right? There's 3 minutes they need that expert to say, provide this medication, or this is the diagnosis, because they've seen thousands of people with stroke, they've seen thousands of people with this dermatological problem. So also, it's really important the way that we introduce this technology to mid-levels. We don't want to say, hey, here's this monitor, we're supervising you, you're not capable. We really want to think of it in a way of, we're giving you this tool so that you can deliver more care to your patients. We're giving you this tool so that you can work at your highest level of expertise, rather than only do things that are very cautious, that you don't have without the help of an expert to say this is the right diagnosis, and you can go ahead and move forward with the management plan that you've initially thought about.
It's been said and more. I think the one thing that we sort of mentioned before, but I think is going to be really crucial, as we see with the uptake of smartphones, is until we have something which has a really good battery life, this is not going to be something that works in emerging markets at all. And I'm sure even with wearables, because you're taking them out, and I know like the battery life on glass is not that great. I can't even keep my iPhone charged for like a day. I have like an external power device for it, right? Yeah. But I feel like that is what's going to make the big difference on uptake of wearables, but also all technology in general in the emerging world. So that's my last point.
It's not a difficult equation to solve, right? I mean, what the panel didn't get to is actually talking about how literally could your headset or your application be used in these UNICEF case studies. So I would challenge everyone in the room, whether you're a person in a startup coming up with the latest technology or you're on the social impact side, I think we have to find ways to literally sit down and start working together of use cases to technologies and starting to adapt. It's not going to happen by us all sort of reading our Twitter streams and sending out sound bites. We all actually have to sit down in rooms together and sort of design these things out together, and that's going to take some work.
I would agree with that. But I would say that, you know, I feel like we've all named several different challenges with respect to getting the products out, getting it used, understanding needs better, etc. And again, it does require multiple heads coming together. And I think sometimes it's a little challenging for governments as well as for private organizations and everyone to reach a common kind of answer. So yeah, so it's exciting to be here to hear that we'll face similar challenges.
I think the collaboration aspect is extremely important. One of the, I think, the greatest strengths that we've got as a company is our very vibrant developer and research community. The amount of innovation that has come out of people licensing the technology, applying it in their own sphere of influence, where they understand the application area, they understand the use case far better than we do. It's much better for you to really focus on what you're good at and open it up to allow other people to embrace what you have and extend it further into application areas that they understand. That's been the most, really most powerful aspect of getting this product out for us. And so we have that as an underlying philosophy for us, which is creating technology platforms that other people will adopt and care about and use and really empower them with tools to help them also make an impact, because that way together we can make a much bigger impact.
Yeah, a couple of things. I think while there are challenges, you know, I talk about you don't know what you don't know. I think the great thing is there's an innovation that's driving forward, and we are going to start to flesh out some things. And if Bomba's example of children that are being kept heated by a light bulb doesn't inspire these people in this room to actually go and start to try and solve some of these problems. I mean, there was a number of data points tonight, but that one to me has certainly taken away how we go and solve some of these problems. So there are challenges, but I think you know, we start by finding out what we don't know and solving the technology problems, some of the connectivity problems, some of the services problems, and where that app lands, and go from there. But I think everybody's mobilized to actually do the right thing, and we'll find solutions.
I think we're in a really amazing age for solutions, leveraging technology, but smart design thinking, understanding the problem set, and getting out there beyond the bubble of the Bay Area, where we all wear glass and have smartphones.
Well, you wear glass.
Yeah, exactly.
Really quickly, before we let Daniel wrap up, the Google Glass team from Google is here in the back demoing devices, so feel free to go find them. They're all in black t-shirts. Our panelists who also have products will be walking around if you would like to talk to them or any of us at UNICEF. So I'll say thank you. Daniel, I'll let you close.
I'll just close by thanking the panelists, thanking Blair, thanking our hosting folks here at UNICEF, Frog, and Wearable World. And with that, let's go mix it up and create the future. Thanks.